Hi, I'm Dr. Mark Poray, a sports chiropractor in Brooklyn, Ontario. You know, here in Durham region, we have the highest per capita number of golf courses in Canada. Naturally, golf is a huge part of the lifestyle in the area, and I see a lot of golfers as part of my practice, including some pros and some extremely good and avid amateurs. In a study of 154 professional golfers, it turned out that 55% had experienced back pain that had forced them to either miss a tour event or to play badly. Now, the PGA Tour Pro chiropractor, Dr. Tom LaFountain, reported that up to 85% of these injuries were related to the spine. Of significance is that 75% of these pros receive regular chiropractic care. That's significant when you consider in the general population the figure is less than 20%. Golfers like Tiger Woods, Mike Weir, Vijay Singh, and David Duval have trusted chiropractic care to keep them golfing at the top of their game for years. What is it about golf that requires chiropractic care so much more than the general population? Well, firstly, it's probably not as much more as you might think. To begin with, the general population, which suffers from back pain at nearly the same rate, doesn't see chiropractors as much as they should. Second, golfers have involved themselves in an activity that repeats a one-sided swinging maneuver between 70 and 150 times per round. This doesn't even include practice swings or range practice. When you consider that the number of tournaments and games in a year, you start to understand that what is most amazing is that pros don't end up more injured than they do. The main reason for this is that these pros have a higher level of specific fitness than the average golfer, and they see their chiropractors regularly. Let's examine the mechanics of the golf swing for a moment. For the most part, the feet are sitting in spiked shoes which lock you into the ground, making what is termed a closed chain. Now, to make an effective, accurate swing, there is a coiling of the body which starts in the wrists, goes to the elbows, the shoulders, down through the abdomen, the hips, the knees, and the ankles. Don't forget that during this coiling, the head and neck are kept in one position looking down, thus effectively twisting in the opposite direction. There's a momentary stoppage as the joints reach their limit. When the swing starts, the momentum or power is built up in the opposite direction, uncoiling this built-up energy from the ankles, the knees, the hips, the abdomen, the shoulders, elbows, and wrist. Once again, the head is kept still, looking down as this uncoiling occurs. At this point, the speed of the club head is the summation of the speed of all those other points, kind of like the thin end of a whip. The more times this movement is repeated, the more important it is that the mechanics are correct. If they are not, the wear and tear on the joints, all the joints, but most importantly the spine, is cumulative and can be devastating. Studies have shown the chiropractic care of the spine corrects spinal mechanics, repairs spinal joint injuries, and improves range of motion. That's not news. What you may not know is that sports chiropractors have the additional training to recognize and correct biomechanics in all the other joints, improve soft tissue function, and treat related injuries. That is why golf pros see their sports chiropractors regularly, and it's a pretty good reason why you should as well. Don't forget that there are other parts of the game which affect your posture, your swing, and ultimately your score. There's a great deal of walking, sometimes over evenly manicured fairways, often over hills, valleys, in forests, rocky stream beds, and sand traps, and so on. And don't forget all the standing around. This is also hard on the low back. According to Tiger, golfers who consistently get up and down around the green have two things in common: great technique and good posture. When a player's game suffers due to pain or faulty mechanics, the enjoyment of the game tends to disappear. There seems to be a higher incidence of injuries in players with poor flexibility, trunk control, or core strength, posture, and poor muscle firing patterns. Back, neck, shoulder, or elbow pain can destroy the swing and ruin your experience. It doesn't have to be this way. If you make regular visits to your chiropractor, having fit and functioning teeth, for example, helps you enjoy your culinary experiences. Healthy corrected vision allows you to enjoy books and movies. Likewise, a healthy spine helps you to get the most out of your golf experience. Here are some hints from the Ontario Chiropractic Association's Get in the Game Without the Pain program. First, get the right fit. Playing with clubs that don't fit can hinder your game and cause you pain. Consult your pro and ensure that your clubs are the right height and are made of the right materials appropriate to your arm strength and have the right grip for you. Take lessons. The right swing technique can do more than just improve your game. It can also spare you plenty of pain. Working with a CPGA pro is a great way to learn the basics. Number 3, warm up and warm down. Take a few moments to stretch before and after your game. Start with a brisk walk and then do some light stretches. Number 4, push, don't carry your golf bag. Pushing or pulling your golf bag and taking turns riding in the cart can help you to prevent some back injuries. If you prefer to carry your clubs, use a double strap carry bag that evenly distributes the weight. Choose the right shoes. That's number 5. Wearing golf shoes with good support and the proper fit can prevent some hip, knee, and lower back pain. 6, and final, drink lots of water. Dehydration can cause fatigue and increase your risk of injury. Water and juice are ideal refreshments. Drinking alcohol tends to deplete the body's fluids and can lead to stiff muscles and soreness. Listen, I hope this has been helpful to you. You can make an appointment to see me about your golf injuries at the Brooklyn Family Health Center by calling 905-655-5767. You can get more information by checking my website at www.drporay.com. I'm Dr. Mark Poray. Thanks for listening.